Hello everyone, I am Mandeep Kaur and my topic is medication errors. So, medication errors are any preventable situations that might lead to incorrect drug usage or patient pain while the medicine is being monitored by the patient, consumer, or any healthcare professional that is considered as medication errors. This is a definition from College of Nurses of Ontario. So, as we know, in the hospital, it's many times medication error occurs. Now, the causes and risk factors of medication errors are: first one is incomplete patient record. Incomplete patient record is sometimes lacking information about which medication a patient is allergic to or other medication the patient is taking. Previous diagnosis or current lab results can also lead to medication errors. Nurses who are not sure should always ask the physician or cross check with another nurse. Next one is systemic problems. Sometimes medication that are not properly labeled medications with similar names placed in the close proximity to the another one. Lack of barcoding scanning system or any other issues can lead to medication errors. Next one, the memory lapses. When a nurse may know that a patient is allergic but forget. This is often caused by distractions, forgetting to specify a maximum daily dose for an as required drug is another example of the memory based errors. The next one is the lack of knowledge. Sometimes there is lack of knowledge among the nurses about the medications. Next one is environmental workflow. Sometimes due to the stress, due to the nurse patient ratio that is not sufficient, it will causes medication errors, and due to the drug interactions. And also when sometimes nurses doesn't have proper knowledge about the drug calculations, it may be due to this medication error occurs. Sometimes there are some drugs which are look alike or sound alike, which will cause confusion between the drugs. It will also causes some medication errors. Now the solution and strategies to overcome the problem. These are the first one is documentation and records. This includes proper medication labeling, legible documentation, or proper recording of administered medication. And the next one is double check or triple check. This is a process whereby another medical staff on the same shift or an incoming shift reviews all the new orders to ensure each patient's order is noted and transcribed correctly on the physician's order. And the next one is ensure the rights of the medication administration. Nurses must ensure that institution policies related to medication administration. It is not adequate to transcribe the medication as prescribed, but to ensure the correct medication is prescribed for the correct patient in the correct dosage via correct route and at a correct time. It's very important for the uh, nurses to provide the medication administration. So next one is checking the patient identity. So it's very important to check the identity of the patient. And next, do not accept incomplete orders, telephonic or verbal orders, to avoid the medication errors. Next one is prepare the medication in a well lighted room. It's very important. And then always check the expiry date before administration of medication. So these are the solution and strategies to overcome the medication administration. So next are the references, and it's all about the medication errors. Thank you.